I couldn't let the month of May end without talking about Lupus Awareness Month. It's observed throughout the month of May, and it's to educate and raise awareness about a chronic autoimmune disease. It's a period that's dedicated to supporting individuals and families that are affected by this disease, and also for funding research to find better treatments and a potential cure. Lupus is an autoimmune disease, meaning that the body's immune system mistakenly attacks healthy tissues. Now, the exact cause of lupus is unknown, but research suggests it's a combination of genetic predisposition and environmental triggers. 90% of people living with lupus are women. It mainly affects Black women and Latino women. Now, most people with lupus develop the disease between the ages of 15 and 44, and it does affect men, but not the way it affects women, not nearly as often. People with lupus can experience significant symptoms such as pain, extreme fatigue, hair loss, cognitive issues, and physical impairments that affect every facet of their lives. Lupus may lead to blood problems, including a reduced number of healthy red blood cells, that's anemia, and also an increased risk of bleeding or blood clotting. Now, there are 3 potential triggers of lupus, include sunlight, infections, and emotional stress. The sunlight exposure, especially if you're in the sun for prolonged periods of time, it can trigger lupus skin lesions or an internal response in susceptible individuals. Infections, including viral or bacterial illnesses, can also initiate or worsen symptoms of lupus. Additionally, emotional stress, such as life events or illnesses like a cold or flu, can contribute to a lupus flare. As someone diagnosed and living with lupus, I want to encourage you to listen to your friends and your loved ones who are dealing with this disease. I was diagnosed in 2005, immediately after Hurricane Katrina. I was under a lot of stress, and I experienced chronic pain. I experienced nosebleeds, headaches, inflammation throughout my body, fatigue, and lupus fog or brain fog. That's a common symptom that's characterized by difficulty concentrating, memory problems, and even confusion. Now, all of these symptoms can significantly impact your daily life, make it harder to perform from simple to complex tasks. I found that my positive attitude, because everything starts here for me, and my positive outlook has allowed me to push through every obstacle and accomplish my targeted goals. I pray, because I am a praying woman now. I read, I write, I'm working on my next book, and quality time with my loved ones. I attend my doctor's visits. I take my medications every day. I also participate in a lupus support group. I advocate for myself. If something ain't right, the doctor's gonna hear about it. I reduce my stresses as much as possible, and I have an amazing therapist, y'all. She's the best. All of this gives me hope. And that's what I strive for, is to share the hope with other Luppies. Hope. So if you know someone who is living with lupus, please consider supporting them. Ask them, how can I help you? And that might look like helping them clean or cook, washing their hair, because it's painful. It attacks your joints. It does mine. How about maybe organizing or participating in a lupus walk? Every year there's a lupus walk. Now see, breast cancer awareness gets a lot of traction, as it should. However, please consider uplifting lupus and other diseases such as leukemia, Sjogren's syndrome, and others, because people are suffering from these diseases. I have all of that and some. I didn't plan on being sick, and definitely not being diagnosed with 11 diseases. No one plans to be sick. No one wants to be sick. I don't want to be in pain, but I have all day, every day. Listen, anything can happen to anyone at any time, anything. And the outcome can be disastrous. If at any point in time you don't feel like yourself, please, I urge you, go and get checked up. If you get a diagnosis, seek a second and a third opinion. Always advocate for yourself. I sure do. And if you're not feeling heard, do your research. Find yourself a better provider. I've had to do that with almost all of my specialists. You matter, and you're worthy. Remember that. You matter, and you're worthy. Subscribe or follow, like, and share this video for more content. I appreciate y'all. Thank you.